हेलो नमस्ते ऑल, आप सबका हार्दिक स्वागत है. वेलकम यू ऑल टू द क्लास. होप ऑल ऑफ यू कैन सी मी, hear me. I consider that all of you have started studying. You're all getting the PPTs, right? Okay, yes, we shall start with day 3. So myself, Dr. Pratibha. So yeah, लेट मी स्टार्ट. सो कल का कुछ बचा हुआ टॉपिक है, कुछ स्लाइड्स है रिगार्डिंग बेसिक एग्जामिनेशन ऑफ द पेशेंट. इसके बारे में एट द एंड हम कुछ बात करेंगे, लेकिन आज का जो सिलेबस है we will just start with that because it's very interesting and I hope all of you will assess your prakriti today. Body constitution, ayurved type of body. Let us see what is your prakriti. So please, all of you sit with the paper and a pen. Okay, एक पेपर और पेन लेके बैठिए. So we will be taking up the questionnaire together, right? So each one of you should participate. So all of you should assess your prakriti today. So last few minutes हम कल का बचा हुआ टॉपिक start करेंगे. A little bit will be carried to tomorrow also. Okay. Let us start. Role of Prakriti in relation to diet. So Prakriti, when I say the term Prakriti, what do you understand? Prakriti is the body constitution, physical, mental constitution of an individual, right? Prakriti is physical and mental constitution of an individual. Every individual is having physical 3 doshas. Now you know which are the 3 doshas: vata, pitta, kapha. Psychological trigunas: satva, raja, tama, inherited in themselves. So हर किसी व्यक्ति के शरीर में ये 3 doshas, that is vata, pitta, kapha, are present. Also manas, I told you, मानसिक दोषास are 2 in number, रजस and तमस, क्योंकि रजस और तमस का कुछ पॉजिटिव पार्ट भी है, नेगेटिव पार्ट भी है. और सत्व नाम का एंटिटी, ये तो सिर्फ गुण है, बिकॉज इट इज टोटल होल एंड सोल पॉजिटिव. देयर इज नो नेगेटिव इन सत्वा. सो द 3 gunas are sattva, raja and tama, लेकिन the 2 doshas are rajas and tamas. Okay, so predominance of these doshas and trigunas defines an individual's physical and psychological traits. So though all of us have all the 3 doshas, 3 gunas, लेकिन किसके शरीर में कौन सा दोष ज्यादा है, किसके मन कौन सा गुण से प्रधान है, we will try to analyze that. See, I also have vata pitta kapha, you also have vata pitta kapha. मेरे माइंड को भी ये सात्विकता, राजसिकता, तामसिकता है, आपके माइंड को भी you have all this. लेकिन किसके शरीर में और किसके मन में कौन सा दोष या कौन सा गुण प्रधान है, whichever is predominant, that becomes the prakriti. Understood? Prakriti also, yeah. One doubt may arise in your body. हमें क्यों ये प्रकृति का ज्ञान जरूरी है, right? You may ask this question and the answer is, once you know that your body once you understand your body constitution and once you know कि कौन सा दोष आपके शरीर में ज्यादा predominant है, it will be easy for you to pre-estimate the disease condition, correct? So हमें पता चलता है कि अगर हमारे शरीर में वात दोष ज्यादा है और हमारा प्रकृति वात प्रकृति है, तो हम कुछ एंटिसिपेट करके कुछ डिसीजेस को, लाइक वात व्याधि, पेन्स, न्यूरोमस्कुलर डिसीजेस को प्रिवेंट करने में कुछ मेजर्स ले सकते हैं, या फिर कुछ मेडिसिन या हमारे एक्टिविटीज में थोड़ा सा differences, अच्छा positive aspects ऐसे we can start introducing so that we stay away from diseases. Staying away from diseases itself is maintenance of health, isn't it? Right. It helps. So Prakriti also pre-estimates the disease condition and helps in prevention and deciding the treatment protocol in diseased condition. Right. So let us start. Here is the questionnaire. Just a minute before that. There are 7 types of Prakriti based on doshas. Vata Prakriti, Pitta Prakriti, Kapha Prakriti, Vata Pitta Prakriti, Pitta Kapha Prakriti, Vata Kapha Prakriti, Vata Pitta Kapha Prakriti. So, singly Vata Pitta Kapha. So, in combination, Vata Pitta, Pitta Kapha or Vata Kapha. And all the 3 together, Vata Pitta Kapha. So we decide the Prakriti with most number of traits of doshas and gunas. So जब हम see there is a set of 14 questions for assessing bodily Prakriti. So आपको क्या करना है अभी? Question number 1 ऐसा नंबर डालिए. इसके आगे either V और P और कफा ये लिखना होगा आपको. ये क्वेश्चनर आंसर करते हुए ये डिसाइड करना है आपको. ओके. We decide then satva, raja, tama. These psychological traits are also a combination of doshas and panchamahabhutas. Yes. Now let us start. Physical traits. Traits. Question number 1. Nature. आपका nature, that is मानसिक स्वभाव कैसा है आपका? See, first option is V, vata. क्या आप फ्लेक्सिबल हो, लाइवली हो, एंथुसियास्टिक हो, यू टेंड टू चेंज योर डिसीजंस, डू यू इनिशिएट सम वर्क्स, सम टास्क्स, देन राइट वी. इसका मतलब है अगर आप इजीली चेंज कर सकते हो या फिर आप बहुत लाइवली हो. सो ऑल दीज, सो दीज थिंग्स हेल्प इन knowing your own prakriti. Correct? Then पित्ता, ट्राई टू अंडरस्टैंड दिस. आपका नेचर, क्या आप बहुत एम्बिशियस हो लेकिन प्रैक्टिकल भी हो, सदा मोटिवेटेड रहते हो, आप बहुत शार्प हो या फिर तीक्ष्ण स्वभाव के हो, यू आर ए गुड लीडर, यू हैव दैट कॉम्पिटिटिव स्पिरिट, लेकिन फिर भी आप बहुत फ्रेंडली हो एंड बहुत करेजियस हो, धैर्यवान हो आप लेकिन फ्रेंडली भी हो. ओके. सो अगर आप में ये सब या फिर इसमें मोस्ट ऑफ द गुनास है तो आप पी ऐसा लिख लीजिए. या फिर लास्ट ऑप्शन देखिए कफा. अगर आप कफा हो तो आप बहुत काम रहते हो, पीसफुल रहते हो, शांत स्वभाव के हो, राइट? और यू आर स्लो लेकिन यू आर अ वेरी, यू हैव लॉट ऑफ पेशेंस, यू आर नर्चरिंग, you are loyal, stable, is you have a stable mind and you have that motherly affection, love towards those who are dependent on you. See, ये 3 में आप कौन सा हो? Which all terminologies would say or depict you? You just try to analyze yourself and put either V or P or K for first question. Okay. Yes. Second question is your physique. See, all of you look at yourself in the mirror. क्या आप thin हो, slim हो, आपका bones prominent लगता है तो वाता. Moderately developed physique है तो पित्ता. Stout, थोड़ा सा bulky हो, well developed, large forehead है तो kapha. So these are all different characteristics of kapha prakriti people. Then observe your skin. So do you have thin, hard, rough, cracked, dark, superficial veins and tendons? या फिर आपका skin थोड़ा सा reddish, pinkish, skin often with moles and acne? या फिर thick, white, pale yellow and oily? Please try to analyze. Okay, write either V or P or K. See, sometimes there can be more than one option also. So in that case, you can write as VP or PK or KV like that. Fourth question is scalp hair and body hair. क्या आपका बाल थोड़ा सा स्कैंटी है, थिन है, कोर्स है, ड्राई या वेवी है? तो इट इज वाटा. अगर आपका हेयर कुछ फाइन है, सॉफ्ट रेड एंड ग्रे, ऑफन बाल्डिंग इन अर्ली एज, प्रीमेच्योर बाल्डिंग, ऐसा है, प्रीमेच्योर हेयर लॉस है, तो पित्त प्रकृति. या फिर कफ है तो डार्क, dense, oily, thick and shiny. So that is for kapha. Then, how is your walking style? Quick, fast, unsteady, या फिर medium, sharp, accurate, या फिर slow, firm, steady and you move less. That is for kapha. Then, आपका वाक, वाणी कैसा है? It is quick, indecisive and you talk a lot. तो vata. इंटेलिजेंट, शार्प, एक्यूरेट एंड क्रिटिकल, विमर्शात्मक हो आप, तो पित्ता. स्लो, स्टडी, कन्विंसिंग एंड स्वीट, देन कफा. पल्स ऑब्जर्व कीजिए अपना पल्स. इज इट फेल्ट स्ट्रांगली अंडर इंडेक्स फिंगर लाइक स्नेक क्रॉलिंग? You will read about this. This Nadi Pariksha is very interesting. I will teach you this in today's class only at the end. ओके आपका पल्स, इज इट फेल्ट अंडर मिडिल फिंगर? देखिए, दिस इज योर हैंड. ओके, फॉर लेडीज वी नीड टू ऑब्जर्व लेफ्ट हैंड, फॉर जेंट्स इट इज राइट हैंड. सो व्हेन वी चेक द पल्स, ओके, सो कहां पर पल्स चेक करते हैं आप सबको मालूम है? यहां से एक फिंगर गैप के बाद 1 2 3 ऐसा रखना है. ओके, ये तो थंब के नीचे. Okay, so this is the place where we see the pulse. Agar pulse is felt more under this index finger, then vata predominance. Middle finger to pitta, ring finger to kapha. So felt under index finger just like snake crawling, या फिर felt under middle finger like frog jumping, or felt under ring finger like slow steady. Okay, next. जॉइंट मूवमेंट्स. अगर आप अपना जॉइंट्स मूव करते हो तो क्या आपको ये क्रैकलिंग साउंड सुनाई देती है? तो इट इज प्रेडोमिनेंस ऑफ वाता. आपका बवल एंड ब्लैडर हैबिट्स कैसा है? इज इट इरेगुलर या आर यू कॉन्स्टिपेटेड? सी, इफ इट इज वाता देन इट इज लाइक दिस. या फिर फ्रीक्वेंट रेगुलर टेंडेंसी टुवर्ड्स लूज स्टूल, तो पित्ता. या फिर रेगुलर, no constipation and no loose stools, then kapha. Then आपका weight, you don't put on weight easily means you're of vata. Moderately you gain weight and lose weight also easily means pitta. या फिर heavy weight gain लेकिन weight कम ही नहीं होगा, वजन कम नहीं होगा, so it is kapha. Then nails, it is rough, dry and splits easily, to vata. Soft and pink, तो pitta. Whitish, pale, shiny, तो kapha. Then आपका sleep, निद्रा, सोना कैसा है? It is poor or disturbed, then vata. You have sound sleep and limited period of sleep, then that is pitta. या फिर excessive sleep, then kapha. So then memory. See, I will tell you about Nadi Vignan after some time. Okay, then memory. Quickly you learn and forget easily and very fast, then you are of vata. You have a sharp and a clear memory, to pitta. Or you are slow to learn and regain for long time, retain for long time, then kapha. Then mental activity. You're alert and easily distracted, to vata. Intense and efficient, to pitta. Slow and thoughtful, to kapha. Right? So please try to analyze among these 14 questions. See, you will have more than 50, 60, 70 questions. If you refer internet for Prakriti analysis questionnaire, you will get more than 50 questions, 60 questions like that. So we have picked only very few which are most relevant, that only we have picked and we have given. So अब तो इन 14 questions में try to find the number of V's, number of P's and number of K's. Okay, so whichever has the highest score, then that is your Prakriti. See, for example, among 14, if you are having 5 vata, 5 pitta, and 4 kapha, then you are of vata pitta Prakriti. Or if it is 10 vata, 2 pitta, 2 kapha, you are mostly vata Prakriti. Like that. Okay. Or if you are getting like 6, and 2, then it is the first 6 scores that you have got. So like that, try to analyze your Prakriti and keep it aside. Or if you are interested, if this has initiated some interest in you, please refer easyayurveda.com or any other nice questionnaires that you will get on Google, right? So try to analyze your Prakriti. See, it is fun, isn't it? It is easy for us to analyze our Prakriti, लेकिन हम अपना friends, अपने relatives, अपने बच्चे या फिर अपने parents या फिर spouse के प्रकृति को easily analyze कर सकते हैं, right? See, to tell you frankly, as much as you read, that much it will become difficult. So if you have that interest, definitely you read. It is fun. Otherwise, try to analyze this much and just keep it aside. Okay. Yes, this is regarding physical Prakriti assessment. See, क्यों हमें प्रकृति का ज्ञान बहुत जरूरी है? Because अगर हम हमारा प्रकृति को एनालाइज करके हमारे शरीर में जो भी दोष है, कौन सा दोष ज्यादा है, ये जान सकते हैं, तो इट बिकम्स इजी फॉर अस टू जान सकते हैं, तो हमें इस पर ध्यान देना चाहिए कि which diseases we are more prone to. And if we know that which diseases we are more prone to, we can take all measures that can cure the disease or reduce the symptoms or prevent the disease in long run, isn't it? Right. Look here, diseases linked with dosha. So vata prakriti people are more prone for many vata vyadhis like paralysis, musculoskeletal disorders, arthritis, that is joint pain, constipation, dermatitis, insomnia, that means sleeplessness, infertility, schizophrenia, something like double personality disorder, malnutrition, and all these. See, not just these, many sorts of pains from a very young age and early aging, all these are seen in people having vata prakriti. But that doesn't mean that everyone who has this vata prakriti will suffer from all these. No, they're more prone to some of the diseases, that's all. Okay, so don't worry if you are getting vata, don't think that I will get paralysis. No, it's not like that. It is like you may be prone to that, लेकिन हम अपने lifestyles में कुछ changes करवा के we can just delay or prevent. Okay, next is pitta. If the prakriti is of pitta, it is likely that people suffer from heartburn, acne is pimples, rashes of the skin, psoriasis, which is an autoimmune disease, IBS means Agni ka Vikriti, digestive related problems, irritable bowel syndrome, ulcerative colitis, anxiety, hormonal imbalance disorders, thyroid disorders, PCOD, bleeding disorders, gouty arthritis, blood pressure related problems. So these are linked with pitta. Next is kapha. Those who have this kapha prakriti, generally they sleep a lot. So the condition called as hypersomnia may set in. Depression, so मानसिक खिन्नता, विषाद भाव, ये भी बोलते हैं. So always depressed mind. So that is seen. Obesity, then diabetes mellitus, swelling, सूजन, and stiffness, हब्दता बोलते हैं. So inability to move properly is stiffness. Respiratory disorders. So all these are some of the diseases linked with this kapha dosha, kapha prakriti. Right? So, yes, now after analyzing the Sharirik Prakriti, let us go forward to see what is our psychological Prakriti. Okay, again, similar questionnaire we have here. We have very simple questions here comparatively. Simple options also. Question number 1. So, traits. कैसा है आपका concentration? एकाग्रता कैसी है आपका? अगर आप सत्ववान हो, सत्व गुण वाले हो, तो very clear perception, clear concentration will be there. Hyperactive if you are rajasic, and you are not able to concentrate at all if it is cloudy. No, that condition is called as cloudy. That means as if something is hindering you from concentrating on your job. Next is peace of mind. कैसा है आपका शांत? Are you, do you have this peace of mind always? Then satvika. Rajasika, mostly you're having peace of mind. लेकिन tamasika, very rarely they will have this peace of mind. Third is honesty या फिर प्रामाणिकता. Okay, so कैसा, what to say, ईमानदार, responsible or honesty, how much honesty we have. So you're very honest. The honesty is strong means you're sattva gunvan. Variable, sometimes you're very honest and sometimes you're not, means it is rajasika. And weak honesty is there means tamasika. Then coming to the speech, so you are always shant swabhav, speak very peacefully, calmly and patiently means you are sattvic. Then agitated, you have that anger and that frustration, that is rajasic. So you are depressed or dull means tamasic. Then cleanliness, high level of cleanliness is sattvic purush. Moderate cleanliness is rajasic. Low hygiene, poor hygiene is tamasic. कंट्रोल ओवर सेंसेस, क्या आपको अपने सेंसेस के ऊपर, इंद्रियों के ऊपर कुछ कंट्रोल है? देन if the control is good, then sattvic. Moderately you can control your senses is rajasic. And then no control at all over senses means tamasic. Attachment, how attached are you with materialistic things? No, you are detached means you're sattvic. See, this is a bit different. Occasionally you're attached and occasionally you're detached is rajasic. Then tamasic is totally attached. You just can't leave certain habits or certain materialistic things or pleasures, so that is tamasic. Right. Next, you know which manasik dosha is there? Manasik prakriti. So after analyzing this, I will give you some more time. You take entire day today, and you can also refer more of Google, internet for further questions. That will give you very nice what to say, number of questions, number of traits. I mean, the number can be different, but your analysis about yourself will be proper. Okay, so these are some of the very important questions that we generally ask. And for most of the patients who have this chronic long-term diseases, we do this Prakriti assessment. When we do this Prakriti assessment before treatment, it will be very helpful for an Ayurveda Vaidya to treat the patient. Knowing about the routine, dinacharya, ritucharya, all these of the patient is very important to give good results, because this is a sort of holistic approach, isn't it? So approach from all the angles in terms of medicines, food, daily activities, exercise, all these have to be told, properly explained to the patient. So it is helpful for you also for your practice. Just okay. So yes, today, I mean, this is just a basic course that you have taken up. Most of you seem to be very much interested by the level of questions that you're asking. I generally feel you're all interested to become very good nutritionists, very good practitioners. So when you develop a client base and when you are exposed to a lot of people, these things should be inculcated in your practice so that it will be very easy for you to assess, analyze. See, the knowledge of Prakriti is very important even for planning the meal. And you can know how much serious the patient is and how the patient's mind is and how much they are able to follow whatever you say. So, Sattva Gunavan, they are very much doctor patients. That means they are very much obedient. Rajasic, occasionally Then tamsito, simply they come to you, they tell everything, but they don't follow anything. So like this sort of analysis is very important for a nutritionist or practitioner, right? So definitely this is going to be of good help. So that day you will remember arogyam when you start practicing, right? Next is nutrition based on doshas. But before that, let me just recall certain things. कल हमने डिस्कस किए थे कि आयुर्वेद का मूल उद्देश्य है आरोग्यवंत व्यक्ति का आरोग्य संरक्षण करना और बीमार लोगों का बीमारी दूर करना. So that means maintenance of health of a healthy individual and preventing by preventing diseases and curing the disease of a diseased person. So both the things are there. So, but Ayurveda stresses more upon maintenance of health of a healthy individual. So, with this regard, Ayurveda has told some important rules and regulations जो हमें follow करना ही है compulsorily so that we are free from diseases, right? So ये तो हमें मिलता है in a topic called as स्वस्थ वृत्ता. स्वस्थ वृत्ता अकॉर्डिंग टू आयुर्वेदा न्यूट्रिशन. हाँ देखिए ये हेल्थी रेजिमेंट तो कुछ टॉपिक्स में डिवाइड हुआ है. पहला है दिनचर्या और डेली रेजिमेंट, दूसरा है सीजनल रेजिमेंट एंड तीसरा है त्रय उपस्तंभ और 3 पिलर्स ऑफ लाइफ, दैट इज आहार, निद्रा एंड ब्रह्मचर्य. Okay, so according to Ayurveda, nutrition is derived not merely from food but from other factors also. कि आपका रूटीन कैसा है, आपका सीजनल रेजिमेंट कैसा है और आपका डिसिप्लिन कैसा है आहार के बारे में, निद्रा के बारे में, ब्रह्मचर्य के बारे में. So all these. Okay, so let us leave this apart. Next week again I will be taking up these topics in detail. Next Monday we will be talking about dinacharya, Tuesday about rutucharya, Wednesday, Thursday about ahar. Okay, so yes, this is next week's topic. Come, let us just see what all we can do to prevent many diseases. अगर हमारे शरीर में वात दोष नॉर्मल से बहुत ज्यादा हो गया है तो हमें क्या क्या मेजर्स लेना चाहिए, राइट? ओके, वात दोष, सी यू हैव डन द एनालिसिस. अगर इसमें वात दोष बहुत प्रधान है, वाता हैज मैक्सिमम स्कोर, then what all will happen? What all will happen and what all measures we have to take? So वात दोष बहुत ज्यादा है already, इसे और बढ़ाने के लिए हमें नहीं देना है. So take these precautions. वात दोष prevention, day sleep of 1 hour is recommended in summers. देखिए हम तो आयुर्वेद वैद्य लोग, we never ask the patient to sleep during the day. So which some people are very much addicted to. So दिन में सोना तो अलाउड नहीं है आयुर्वेद के अनुसार, इसलिए जनरली वी आस्क द पेशेंट्स टू अवॉइड डे स्लीप. लेकिन जिन लोगों के शरीर में वात दोष ज्यादा है, so they have to sleep during the day at least for 1 hour. Especially in summers, do not miss sleeping in the day. Okay, just 10 minutes या 15 minutes का नैप तो बहुत अच्छा होगा अगर वात दोष बहुत ज्यादा है शरीर में तो. Then late night awakening is prohibited. Do not do this रात्रि जागरण. रात में जल्दी से सोना है 10 o'clock या इससे पहले भी सो सकते हो. So that is very important. अगर हम रात को देर तक जागते हैं तो it will cause increase of vata further. So do not stay awake for long duration at night. Next, need rest in between long physical strain and mental strain. So work at one go should be avoided. Mind and body both cannot work too much for long duration together. Next is excessive exercise nahi karna hai vata prakriti walo. Then walking too much is not good. Prolonged standing is also not good. Excessive speech should be avoided. Excessive thinking, please do not do that. Excessive indulgence in coitus or sexual intercourse should be avoided. Too much is too bad. So excessive traveling also should be avoided for vata prakriti people. Lekin they can definitely adopt this yoga and meditation which help a lot to control vata. Listening to calm music and happy state is required. So that should be done. So these are some important changes that they can adopt in their lifestyle. Lekin Ayurveda treatments क्या है? We will just see. See, these things, what I will be saying now, you will have difficulty in understanding it at the beginning. This topic will be repeated on Monday. Some of the important terminologies, you can just make a note here itself. So Monday we will be talking about dinacharya or daily regimen. So उस दिन इसके बारे में आपको ज्यादा पता चलता है, जानकारी ज्यादा हो जाता है that day. Okay. Daily abhyanga, that means massage with gingerly oil, is recommended, especially in winters and once in a week at least in summer. So remember, everyday abhyanga is very important. Second is pratimarshanasya, that means pratimarshanasya. Nasya is one among the panchakarma treatments. So panchakarma treatment में जो हम nasya treatment करते हैं, इसका एक सिंपलर फॉर्म जो है विच इज कॉल्ड एज प्रतिमर्शनस्य. सो इस प्रतिमर्शनस्य को हम हर रोज कर सकते हैं. सो प्रतिमर्शनस्य इज रिकमेंडेड. 2 drops per nostril will keep the nasal mucosa moist. Likewise, karnapuran, filling of ears with some medicated oils if it is necessary. I will teach you how to do that next week. अक्षितर्पण नाम का एक स्पेसिफिक ट्रीटमेंट है. Make a note of this Akshi Tarpan. Akshi ka matlab hai eyes and Tarpan means nourishing. So this is a procedure which is directed towards improving the health of the eyes. So ye Akshi Tarpan karna bahut important hai for Vata Prakriti people to avoid excessive strain and dryness of the eyes. Right? So that procedure and all will be explained in further classes. Then Kavala, that is gargling. Gandosh means oil pulling. With vata reducing herbs or vata reducing substances like gingerly oil, khadira kashaya, cloves, that is lavanga, saindham lavana, irimedadi taila, triphala kashaya, all these should be done. और इसके साथ थोड़ा सा cow ghee should be added in all the 3 meals. Make your food moist so that it becomes easy for gulping. क्योंकि वात प्रकृति वालों का तो बॉडी बहुत ड्राई होगा. Okay, so that has to be combated. इसलिए थोड़ा सा moisture should be there in the food. Then use erend tail 1 to 2 teaspoons for chronic constipation for about 15 days continuously. Yes, definitely you can take the advice of Ayurvedic specialists. For that you can get in touch with our Arogyam team coordinators. They are continuously, they are non-stop working round the clock. So you can get in touch with our coordinators, and if you need any consultation with specialists of Ayurveda of our team Arogyam, they will be there to help you regarding this. Then next slide, it says anti-vatahar herbs. Actually, it is not anti-vatahar. It should be anti-vata or vatahar. Here it becomes double negative. Okay. So vata reducing herbs and formulations are Nirgundi patra, that is Nirgundi leaves. Erand patra means castor leaves. Datura patra, then curry leaves, ashwagandha, dashamul, spices like ginger, black pepper, fennel, ajwan, hing and shilajit. These are very good. So ahar kaise hona chahiye? It should be smooth and bit more nourishing, that is quite heavy and warm food. Taste should be sweet, sour, salty. Food should be consumed fresh, warm. Fasting is not recommended for vata dosha. So those who are of vata prakriti, they should not do fasting too much. Diet should include warm milks, sweet fruits, nuts, milk, butter, hot cereals and all these. So this is regarding vata prakriti. Next is pitta prakriti या फिर पित्त दोष. अगर हमारे शरीर में पित्त दोष नॉर्मल से ज्यादा है या फिर हमारा प्रकृति ही टोटली पित्त है, सो हमें क्या क्या प्रिकॉशंस लेना पड़ेगा? देखिए, यू हैव टू प्रिवेंट ऑल दीज, लाइक अवॉइड सन. सो टू मच एक्सपोजर टू सन इज नॉट गुड. डोंट आस्क मी, अगर हम सन के लिए एक्सपोज नहीं होते हैं तो क्या हमारा विटामिन डी कम हो जाएगा? यस, इट हैपेंस. We are just telling you to avoid excess exposure to sun, right? So avoid sun, excessive exercise, moderate rest is required. Again, daytime में थोड़ा सा rest कीजिए. Then midnight meals to be avoided. Early dinner is always very good. And then spicy and sour food should be avoided, क्योंकि spicy and sour food लेने से शरीर में पित्त दोष ज्यादा बढ़ेगा. So mid to moderate exercise is required. Yoga and meditation are helpful. Then इसके साथ ही timely, once in 6 months or once in 1 year, please donate blood. So blood donation should be encouraged. Encourage more fluid intake like lemon juice, fruit juice. Then do massage yourself with Chandanadi Taila in the areas where there is burning sensation. कुछ पित्त प्रकृति वालों को तो जलन ज्यादा होता है, redness, jalan, all these will happen. That can be avoided by doing massage with Chandanadi Taila regularly. Mild purgation, that means intake of some mild laxatives with the prescription of Ayurvedic doctors is very important, क्योंकि ये रोज बेसिस में पित्त दोष, बढ़े हुए पित्त दोष को शरीर से बाहर निकालने में असिस्ट करता है. So mild purgation is advisable with Triphala Kvat or Eranda Taila with milk is advised for removal of excess pitta from the body. Lepa application like paste, tilka paste, then muletika paste, dashang lepa, these are recommended for swelling and inflammation. Nasya with kshira, ghrita, onion juice, all these are recommended. And then anti-pittahara herbs and formulations. Muletika, this is again anti-pitta or pittahara. It can't be anti-pittahara, right? Muletika churan, manjishtadikvata, neem ka kashai, chiraita churan, avipatikar churan. These are actually very good. They can be, these formulations can be taken under proper prescription of a Ayurveda Vaidya, registered Ayurvedic medical practitioner, right? Next is kapha dosha या फिर kapha prakriti. अगर आपका प्रकृति kapha है, so you know what all diseases we are more prone to. So हमें क्या करना चाहिए, हमें क्या क्या measures लेना चाहिए कि to avoid many diseases related to kapha prakriti, like it can be obesity, diabetes, whatever. So हमें क्या क्या करना चाहिए? Remember this. आज का ये आधुनिक युग में sedentary lifestyle is becoming very prevalent. इसलिए kapha prakriti वालों, please beware of day sleep. Do not sleep during the day. Do not have heavy food and आराम से sleep for 2 to 3 hours. I've seen many people doing this, even though they are professionals. क्या होता है कभी कभी, अगर they are starting their work in the evening or in the afternoon, morning they get up late, or they finish all the work early in the morning, they come home and sleep. Both are not good. So avoid day sleep, prolonged rest, sedentary lifestyle. Avoid cheese, creams, curd rice too much. Physical exercise is recommended mostly for kapha prakriti. See, physical exercise is important for everyone, लेकिन सिर्फ वात प्रकृति वालों को ज्यादा physical exercise should be avoided. That's all. So it doesn't mean that they are not good. I mean, they are not suitable for exercise. No, they also have to do exercise. लेकिन ज्यादा तो कफ प्रकृति वालों को आवश्यकता है. Avoid frequent eating. So don't eat next meal unless previous meal is digested. Otherwise, it causes ama. So ama, you remember this? First time you're hearing to this word. So ama का मतलब हम आपको कल समझाएंगे. So just understand that ama is some indigestion like condition. Okay, so frequently don't eat. So एक मील ठीक तरह से डाइजेस्ट होने के बाद ही दूसरे मील लेना है. Then honey, barley, these are very good. Diet should be warm, light for digestion and good. Taste तो astringent, pungent and bitter होना चाहिए. That is actually advisable. Fermentation, that is Svedana treatment is very good for them. Steaming is good. Udvartan means coarse fine powder of herbs is prepared and rubbed on the body anti-clockwise direction. Vaman नाम का एक पंचकर्मा ट्रीटमेंट कफ दोषों के लिए बहुत अच्छा है. So Vaman means medicated emesis. I will tell you more in further days regarding what is Vamana. But if you are more interested, you can just make a note of this and refer. Vasti can be planned. Vasti ka matlab hai kuch medicated enemas. So medicated enemas can be given for kapha prakriti people for reducing kapha dosha. Nasya with pungent drugs is recommended. Nasya means putting some medicated oils and such other preparations into the naak. So that has to be inhaled and spit out. So this helps in clearing of the passage, and it is very much strengthening for all the sense organs. So I will tell you more about Nasya in further days. So Nasya with pungent drugs is recommended. Herbs and formulations for reducing kapha dosha are Trikatu Churan, Trifala Churan, Dashamularishta, Loharishta. See, these are classical Ayurvedic formulations. Okay. Most of the spices are Kapha so they can be Kapha in sense kapha reducing. So they can be used accordingly in various preparations like in food, soups, manda, yusha. See, these are some preparations. I will be telling you more about this. So this is how we need to take care agar hamara prakriti kapha hai. Yes, now let us try to understand what is sattvic diet, rajasic diet and tamasic diet. So what is this sattvic diet? So भगवत गीता में श्री कृष्ण ने इसके बारे में बहुत बात किए है, right? So you find preachings of Lord Krishna in Bhagavad Gita where sattvic diet means that which is not too sweet, not too salty, not too spicy. Consuming sattvic food helps in purifying our body and mind. Fresh food grains such as rice, wheat, oats, legumes categorized under sattvic food. Further, fresh green vegetables, fruits, and slightly roasted seeds and nuts are also sattvic. Fresh milk is sattvic, but after we pasteurize, it becomes tamasic. Like in pasteurization, yeah, boiling is very important, definitely, right? The environment where we are taking food should be clean and pious. Then, what is the meaning of rajasic? So, agar aapka liking sattvic diet hai, to definitely there is lot of sattvikata inside you. So, agar aapka choice rajasic jaisa hai, let us see what type of diet is rajasic. Meats and fish that are spicy fall under rajasic food. So, anything khatta mita, all those hot and spicy things, those are all rajasic. Pungent vegetables with excessive starch intake like potato, cabbage, broccoli, and cauliflower also fall under rajasic food. Alcoholic drinks, preserved food, fried food, coffee, and tea are some other foods that have rajasic nature. So this is about rajasikata, rajasic type of food. So just try to know which is rajasic diet. So अगर आपका physiological traits, psychological traits में rajasic ऐसा आया है, so try to avoid these. Okay. Then what is tamasic diet? Apathya, that is don'ts regarding ahar mentioned in the texts. They are all tamasic. Garlic, onion, urad dal, fast food, these are all tamasic. लेकिन garlic, onion का कुछ बहुत importance हमें important references तो हमें मिलता है कुछ चिकित्सा में. Many diseases, vata related diseases में garlic and onion preparations are found. So as food, eating this garlic onion is liking towards that is tamasic food. Lekin as medicine, it is advisable in many diseases, right? So this is about sattvic, rajasic and tamasic diet. I hope कि आज का क्लास आपको अच्छी तरह से समझ में आया है. Sorry, my Hindi is not so good. I'm not very much used to speaking in Hindi, but definitely I can manage. And I hope those who are listening to me, expecting lot of Hindi, they might be disappointed. But I don't think it's difficult to understand, isn't it? The syllabus is quite easy, right? So this is about aaj ka class. So we still have some time. Instead of leaving early or instead of talking anything, let us just try to talk about, let me just give a try regarding completing the syllabus, yesterday's syllabus. Little bit is remaining. please permit me to carry on with the yesterday's syllabus. Okay. I hope today's syllabus is very much clear, right? So examination part we will discuss now. So I will deal with this examination part little bit today and little bit tomorrow also. Yes. So yesterday we discussed about doshas, dhatus and malas, isn't it? So also Panch Mahabhutas and then causes of diseases. We have discussed about all these things, but we have leftover, topic examination of disease and disease. कुछ रोगास and rogis को कैसे एग्जामिन करते हैं आयुर्वेद वैद्य लोग. If you are having that doubt, you might have heard कि Ayurveda Vaidyas take a lot of time in talking to patients, analyzing patients, consulting patients. So how to deal with this, or how they are trying to analyze, what all questions they are asking. You might be curious regarding that. Let me just tell you that there are 3 types of examination basically. So one is Trividha Pariksha, yeah, Ashtavidha Pariksha, Dashavidha Pariksha. Okay, these are 3 important topics regarding which we generally talk Ayurveda Vaidyas. That is how we examine. A short, brief insight into basic examination. Trividha Pariksha is the tri-fold examination. 3 types of examination: Darshana, Sparshana and Prashna. Darshana का मतलब है inspection or observing the patient. Patient is still waiting in the waiting room. The doctor is inside the consultation room. So the patient comes from the waiting hall to consultation room. So that entire process of coming and sitting and talking to the patient, all these without asking questions, the doctor observes many things. So this is called as Darshana Pariksha. तो पेशेंट को ऑब्जर्व करने से हमें क्या क्या पता चलता है, पेशेंट का हाइट, वेट, you can just have a basic view or basic insight into how the patient's build is. Then complexion, whether it is healthy look, healthy glow, या फिर diseased condition, like color of the skin, or if there is any redness of the eyes, if there is any specific manifestations on the skin, so many things. The patient's gait, how the patient is walking and coming, whether the patient is able to walk or not, or whether the patient is finding it very difficult to move, all these things the doctor can analyze just by seeing. So that is called as Darshana Pariksha. Second is Sparshana Pariksha. So kuch dekhne ke baad the doctor will ask some questions to the patient. That forms a part of Prashna Pariksha. That is the third one. So questioning the patient in favor of his healthcare. कब से आपको ये प्रॉब्लम हो रहा है, क्या खाने से ज्यादा होगा, कितने बजे, what time of the day do you suffer a lot, and if the patient's family history is supportive for the manifestation of diseases or any other such questions. That is called as Prashna Pariksha. Sparshana का मतलब है the patient is made to lie on the examination table. So the doctor does some palpation of different organs, auscultation using the stethoscope, then percussion, organs ka examination. All these are done by touching the patient. That means doctor uses his senses in trying to know about the disease of the patient. So that is called as Sparshana Pariksha. So this is the basic tri-fold examination of the patient. Right. Next is Ashtavidha Pariksha, जिसे हम बोलते हैं Ashtasthana Pariksha, the 8-fold examination. 8 important entities or characteristics or features are seen. First is Nadi. Nadi is the pulse. The famous pulse examination के बारे में हम कल बात करेंगे. So because that is there in the syllabus also. So Nadi Pariksha is the famous pulse examination. So the doctor with his right hand generally examines the pulse of the patient. Then Mutra Pariksha. So some tests are advised. In olden days तो आयुर्वेद वैद्य लोग एक स्पेशल वेरी यूनिक परीक्षा करते थे कि तैल बिंदु परीक्षा. So मूत्र पेशेंट्स सैंपल ऑफ यूरिन, इसमें कुछ आयुर्वेदिक तैलास को ड्रॉप करके, ड्रॉप बाय ड्रॉप या फिर एक या दो ड्रॉप, वो ड्रॉप कैसे चलता है, ड्रॉप का गति क्या है. So all these were examined by the patient, by the doctor, and the doctor would say about the prognosis of the disease. क्या ये disease चिकित्सा योग्य है, चिकित्सा करने से कम होता है, that is साध्य रोग है या असाध्य रोग. All these the doctors were able to analyze. So this is how मूत्र परीक्षा was conducted. मल परीक्षा, आजकल तो हम स्टूल एग्जामिनेशन करवाते हैं, इसके द्वारा हमें पता चलता है कि अगर स्टूल्स में कुछ प्रॉब्लम है, लाइक ओवास सिस्ट्स आर देयर, या फिर स्टेरकोबाइलिनोजन का कुछ अंश ज्यादा है या कम है, क्या ये जॉन्डिस रिलेटेड प्रॉब्लम है या फिर वर्म्स रिलेटेड प्रॉब्लम्स है, ऑल दीज विल बी नोन विद द लैब एग्जामिनेशन. और हम तो पेशेंट्स को पूछते भी है, राइट, लाइक how is the stool, what is the color, is there any abnormality, like if there is any blood, occult blood in the stool, or which gives us a clue. If there is blood found, that gives a clue regarding some underlying disease. If the blood has already formed clot somewhere and has changed the color also, that also is seen. Okay, so that also is asked, known through the mala pariksha. So these are some of the methods. And then jihva pariksha, patient's tongue is examined. Mostly doctors would keep a torch in their hand and examine the tongue, or well illuminated room में well illuminated room में examine करते हैं. So that is how the tongue is examined, and if there is any coating or if there are any lesions, discoloration, cracks, ये सब कुछ दिखाई देता है. So how is the tongue, which gives a clue regarding digestive system. टंग तो एक कॉमन फीचर है, मुंह तो हमारा रेस्पिरेटरी सिस्टम और डाइजेस्टिव सिस्टम में दोनों इन्वॉल्व है, राइट. देन शब्द परीक्षा, स्पीच एग्जामिनेशन. सो ट्राइंग टू नो द हाउ द पेशेंट टॉक्स, द वॉइस, how it is, whether it is healthy, if there is any cracked voice or resonant, all these things. If other sounds and different other sounds that are coming from the different parts of the body of the patient, like gurgling sounds of the abdomen, joints में कुछ sounds, all these are examined, right. So that is शब्द परीक्षा. स्पर्श परीक्षा is touch examination. टच करने से कौन सा organ कहाँ पर कैसा स्थिति में है, all these will be known. And also hotness, coldness, temperature will also be known, right. That is touch examination. Drik pariksha, that is vision, how the eyes are, because eyes are the index of good health, I mean health. So bright and very healthy eyes indicate good health. So redness या फिर yellowishness, dullness, droopy eyes, या फिर any other changes in the eyes, all those are examined. Akriti pariksha is examination of patient's physical appearance. So that is generally done. Okay, then the last type of pariksha is dashavidha pariksha. dashavidha pariksha का मतलब है 10-fold examination. Let me just finish this within 5 minutes, and 6:05 I will end the class. Okay, so what is this dashavidha pariksha? That is 10-fold examination of the patient. So what all entities हम यहाँ पर consider करते हैं? First is prakriti. So now you're all knowing how to examine the prakriti, right? So by giving questionnaire or by general proper observation, you're able to know the prakriti. अगर प्रकृति या बॉडी कॉन्स्टिट्यूशन को समझते हैं, इसके बाद विकृति क्या है ये भी समझ सकते हैं, राइट. ये नेचुरलिटी क्या है जानने के बाद डिस्कम्फर्टनेस क्या है ये पता लगाना बहुत आसान है, राइट. देन सार परीक्षा, that is examination of dhatus in the body. You all know that there are 7 dhatus in the body. Rasa, Rakta, Mamsa, Meda, Asti, Majja, Shukra. So these are the 7 dhatus. ये धातुस का quality कैसा है? How the quality of the dhatus are? They are superior, inferior, moderate, healthy, unhealthy, not so good. All these are known by various techniques. Like we have special criteria for assessment of rasa dhatu. रससार पुरुष है तो क्या क्या फीचर्स हमें इसमें देखना है, रक्तसार लोगों में क्या. So all these are generally done. Then samhanana pariksha is examination of integrity of body parts. कैसा है इसका body parts, क्या थोड़ा सा शिथिलता है, थोड़ा सा problem है, all these are known. Pramana pariksha, that is measurement of respective body parts. This is also done in special cases like obesity or sujan या फिर कुछ inflammatory conditions या फिर anything. Measurements are taken. Satva pariksha, satmya pariksha, that is examination of habituality or suitability of the body of the patient. Then sattva pariksha, that is examination of how much control the patient has over his or her mind and how much the patient is determined to take the treatment. कितना डॉक्टर का कुछ सजेशंस को फॉलो कर सकते हैं पेशेंट्स, ये सब विचार के बारे में हमें पहले ही पता चलता है, right? Isn't it? By talking to some people, you understand how serious they are about any treatment, isn't it? Right? Like that. Ahar Shakti, that is examination of digestive fire of the patient by assessing the portions of his meals. Then Vyayama Shakti, examination of activeness or laziness of the patient by assessing the capability to exercise. Vaya Pariksha, see whatever might be the number, examination of age of the patient, whatever might be the number, consider that there are certain diseases which happen to occur in certain age groups. ये like बाल्यावस्था में कुछ kapha related problems, मध्यमावस्था में pitta related problems, और old age में vata related problems. All these are generally done. So tomorrow I will be talking about Nadi Pariksha. So Nadi Pariksha is very interesting. We'll be telling you about how to do pulse examination, the basic view, like what is Sarpagati, Mandukagati, Hamsagati, all these I will be telling you tomorrow. Then Jeep ka examination, and then Mala Mudra Pariksha, all these. I will be talking about this tomorrow, last 5 minutes, right? So saying this, I'm very thankful to all of you for your patient hearing. Thank you so much for your kind cooperation. Put all your questions in the query form. I will be answering all your questions this Friday. Okay. Yes. So saying this, I will end the class. Namaste. Happy evening. All of you, please have that involvement regarding studies. Thank you. Thank you. Namaste. Bye. So try to assess your Prakriti once again, your family members ka, your friends ka. It will be fun. Right? Bye-bye.